Sri Akbaruddin Owaisi garu.
Honorable panel speaker, sir. Sir, I take opportunity to participate in the short discussion on the measures taken by the Telangana government for strengthening the education sector in the state. The Honorable Minister for Education, Madam Sabita Indra Reddy Sahiba, has given a detailed account of these initiatives and outcomes over the last 9 years in the notes circulated to us for the short discussions. She has pointed out that the total allocation for education has increased almost threefolds, from rupees 9,518 crores in 2014 and 15 to rupees 29,611 crores in current financial year, that is 2023 to 2024. I compliment the Telangana government for focusing on the education sector beside Medicare and other sector. And at the same time, there are some few places where it is required that an attention is being given, sir, which further I am going to bring to the kind notice of the Minister for Education. Honorable panel speaker, sir, already this morning we have discussed about the enormous growth in number of residential schools for the weaker section, including opening of the schools for minorities and backward classes, apart from scheduled caste and scheduled tribes, while the number of residential schools more than doubled, and the allocation has gone fourfold in the last 9 years. Sir, there is one thing which I would like to bring to your kind notice, sir. Sir, earlier in the morning, there was a question about residential schools. And the number of residential schools which were there before Telangana and now was given, sir. And unfortunately, sir, the number of schools which have been mentioned, residential schools, in this note is different from the reply given by the minister then about residential schools. I don't know where it is, it needs to be corrected, but I think this should be corrected. No, not this. I'm just not having that paper, sir, that question. I'll just give it to you. Honorable panel speaker, sir, as far as residential schools are concerned, the residential schools are functioning very good, I would say. And to come on record, I can also say that they are doing wonderful work in field of education. And many students are getting benefited from the residential schools. And lot of students are also cracking the exams in IITs and IIMs, and also seeking admissions in very renowned universities as well. They're getting good scores in NEET, also in MSET, and other competitive exams. So I would say that the residential schools are doing wonderful work. Earlier in the morning, I had asked the Honorable Minister Saab to give me the details of as to how many students are studying in the residential school. But in the note, Minister Sahiba had given the details as to 7,44,759 from 2014 to 23, and also has given the details of budget allocation for residential institutions have increased from 973.37 crores in the year 13 to 14 to rupees 4049.01 crores in a financial year for 23-24. So I congratulate the government for the wonderful work which is being done in residential school as far as 7,44,000 24,759 students are concerned. But at the same time, Honorable Panel Speaker, sir, when we see the note table on the page number 2, there is a detail about school education which says that there are 26,065 schools with an enrollment of 23,21,765 students and 1,03,471 teachers in school education department. So now, the question that arises is that as far as 7,74,000 children are concerned, we are doing a wonderful work, and the work is very good, sir. But when we see 26,065, but as per the information which I have, Honorable Panel Speaker, sir, the total number of government residential schools is not 26,065. The total number of government schools is 27,477. So this number of schools which I am mentioning is not mine, sir. Sir, I head the Public Accounts Committee. Recently, we had a meeting of Public Accounts Committee, and in the Public Accounts Committee, we had a discussion about school education, and in that meeting, the Education Department has given these details and said that they have 27,477 government schools over here. So I really don't know which number is right. So from last 5 years, I have been screaming and shouting and saying that when one comes to this house, not us, the officials, they should come prepared and they should come with the right numbers and right figures. Anyway, sir, going further ahead, when I say that these residential schools are doing wonderful work, the government schools are also not in really a bad shape, I would say. They are doing good work, but there is a lot of scope of improvement which is required. और हमको इस बात पे तवज्जो देनी चाहिए कि इन गवर्नमेंट स्कूल्स में तेलुगु मीडियम के स्कूल्स है, उर्दू मीडियम के स्कूल्स है और इंग्लिश मीडियम के भी स्कूल्स हैं। सर, जब मैं उर्दू मीडियम की बात करता हूं तो पैनल स्पीकर साहब, मैं आपके जरिए मिनिस्टर साहिबा को ये बात याद दिलाना चाहता हूं कि मिनिस्टर साहिबा ने ऐवान में तयख्खुन दिया था कि हम बहुत जल्द डी रिजर्व करेंगे सीट्स को और डीएससी मुनक्किद करेंगे। ऑनरेबल पैनल स्पीकर सर, 1.5 साल से जायद का अरसा गुजर चुका है और आज तक भी उन सीट्स को डी रिजर्व नहीं किया गया। जैसा कि मैं बताना यह चाहता हूं कि उर्दू मीडियम में जो रिक्रूटमेंट होता है उसमें रिजर्वेशन की पॉलिसी भी रहती है। रिजर्वेशन की पॉलिसी में एक एससी, एसटी, बीसी सारे लोग आते हैं, उनको देना जरूरी है, लेकिन वो उर्दू से वाकिफ नहीं रहते हैं। तो उर्दू से वाकिफ नहीं रहने की वजह से वो रिजर्वेशन पॉलिसी की वजह से वो वैकेंसीज अनफिल्ड रह जाती हैं और रूल पोजीशन और कानून के हिसाब से 1 से 2 मरतबा, 2 से 3 मरतबा नोटिफिकेशन देना पड़ता है। उसके बाद भी अगर कोई नहीं आते हैं तो वो सीट्स डी रिजर्व हो जाते हैं। और इस बात का तयक़ुन मिनिस्टर साहिबा ने इस ऐवान में दिया था आज से 1.5 साल पहले कि डी रिजर्व करेंगे हम। तो उर्दू मीडियम्स को हम जब देखते हैं तो हो सकता है मैं गलत हूं, प्लीज करेक्ट मी इफ आई एम रॉन्ग, कि एज पर माई नॉलेज more than 525 vacancies are there in Urdu medium schools. उर्दू को इस रियासत में दूसरी सरकारी जबान का मौक़िफ़ दिया गया मजलिस इत्तेहाद उल मुस्लिमीन के मुतालबे पर। बहुत बड़ी बात है कि तेलंगाना में उर्दू दूसरी सरकारी जबान है। दूसरी सरकारी जबान रहने के बावजूद भी उर्दू के साथ वो नाइंसाफी क्यों? उर्दू को इंसाफ मिलना चाहिए। और जब हम इंसाफ की बात करते हैं तो यह बात कही जाती है कि बच्चों को दिलचस्पी नहीं है उर्दू मीडियम में या तेलुगु मीडियम में पढ़ने की। नहीं, उर्दू मीडियम और तेलुगु मीडियम में पढ़ने में भी बच्चों की दिलचस्पी है, और हमको उर्दू को भी बाकी रखना है, तेलुगु को भी बाकी रखना है, क्योंकि दिस इज आवर स्टेट, हमारी इस रियासत की जबान है और कई लोगों की मादरी जबान है, मदर टंग है। उर्दू भी वैसी हमारी रियासत की दूसरी सरकारी जबान है और कई लोगों की मादरी जबान है, मदर टंग है। और सर उसके बाद में फिर हमने न सिर्फ डीएससी डी रिजर्वेशन के बारे में कहा था उर्दू मीडियम के ताल्लुक से, कॉन्ट्रैक्ट लेक्चरर्स के बारे में भी हमने कहा था कि उनकी सर्विसेज को रेगुलराइज करने के लिए कॉन्ट्रैक्ट लेक्चरर्स जो उर्दू मीडियम के थे, दूसरे लोगों का किया गया था, इनका नहीं किया गया। फिर उसके बाद में कई वैकेंसीज थे जूनियर एंड डिग्री कॉलेज में उर्दू मीडियम के, तो उस वक्त बच्चों की तालीम मुतासिर हो रही थी, तो हमने माइनॉरिटी फाइनेंस कॉरपोरेशन के जरिए उनका तखर्रुर करवाकर उनसे काम लिया गया था उर्दू मीडियम के बच्चों को जूनियर एंड डिग्री कॉलेज में पढ़ाने के लिए। और फिर उसके बाद में कई लेक्चरर्स को कॉन्ट्रैक्ट बेसिस पे लिया गया था, टेम्परेरी बेसिस पे लिया गया था, सेल्फ फाइनेंस के जरिए लिया गया था, और उनसे भी वादा किया गया था कि उनके सर्विसेज को भी रेगुलराइज करेंगे। आज भी वो सर्विसेज रेगुलराइज नहीं हुए। तो मैं आपके जरिए मुतालबा करूंगा कि उर्दू के साथ इंसाफ कीजिए, चाहे वो उर्दू मीडियम के स्कूल्स हो, उर्दू मीडियम के जूनियर कॉलेजेस हो, या उर्दू मीडियम के डिग्री कॉलेज। सर, I would like to thank the state government and in particular the honorable chief minister साहब के, चंद्रशेखर राव साहब के, कि हमने मुतालबा किया था कि पुराने शहर में डिग्री कॉलेज होना है, हमको जूनियर कॉलेज भी होना है। तो उस वक्त चीफ मिनिस्टर साहब ने ऐलान किया कि चंचलगुड़े में, और फिर चंचलगुड़े में, और उसके बाद में फिर फलकनुमा में भी जूनियर कॉलेज का क़याम अमल में लाया जाएगा। लेकिन उस वक्त सिर्फ 2 जगह पे हुआ। फिर मैं याद दिलाना चाहता हूं कि जब हमने माइनॉरिटीज के बारे में जब गुफ्तगू की थी, तो जब हमने बताया था कि ऑन पार विद SC ST से की तरह मुसलमानों को भी देना चाहिए, तो उस वक्त हमने फिर मुतालबा रखा था, KTR साहब को भी याद होगा कि हमने उस वक्त रखा था कि देयर इज नो जूनियर कॉलेज इन बहादुरपुरा। फिर ये भी हम बोले कि देयर इज नो डिग्री कॉलेज ऑल्सो इन बहादुरपुरा। एंड आई हैड मेंशन्ड दैट कि देयर इज अ 9 acres ऑफ लैंड अवेलेबल इन ITI बहादुरपुरे में, वहां पे एक जूनियर कॉलेज आप खोल सकते हैं। KTR साहब ने उठकर उस वक्त तयखुन दिया था और बोला था कि हाँ, हम बहादुरपुरे में पुराने शहर में ITI की जमीन में से कुछ थोड़ी सी जमीन लेते हैं और जूनियर कॉलेज को और डिग्री कॉलेज को वहां पे स्टार्ट करेंगे। तो मैंने उस वक्त कहा था कि साहब, उर्दू मीडियम के साथ इंग्लिश मीडियम जूनियर एंड डिग्री कॉलेज शुड आल्सो बी स्टार्टेड देयर। बहादुरपुरा असेंबली कॉन्स्टिट्यूंसी डजंट हैव अ जूनियर कॉलेज and a degree college. So we have been repeatedly requesting for this. I hope that the government will take a note of this. और फिर उसके बाद में हमने कई मुतालबात रखे उर्दू के ताल्लुक से। तो मैं पैनल स्पीकर साहब आपके जरिए, मैं KTR साहब है, हरीश राव साहब है, और हमारे माइनॉरिटी वेलफेयर के मिनिस्टर साहब है, और उनके साथ साथ एजुकेशन मिनिस्टर सबिता इंद्रा रेड्डी साहिबा है, एक ही रिक्वेस्ट और मुतालबा करूंगा कि एक मीटिंग हम सिटी लेजिस्लेचर्स के साथ करिए, ताकि हम उर्दू मीडियम के जो इश्यूज हैं, चाहे वो स्टूडेंट्स के हो, चाहे वो टीचर्स के हो, जहां कहीं के भी हो, सारी रियासत के इश्यूज हम तक आते हैं, रुजू होते हैं। अगर एक मीटिंग अगर आप बुलाएंगे तो हम सारे मसाइल को आपके सामने रख सकते हैं, ताकि उन मसाइल का हल जो भी मुमकिन हो सकता है हम कर सकते हैं। यह बात मैं इसलिए कह रहा हूं कि अगर हम ये काम करेंगे तो एक अच्छा पैगाम जाएगा, एक अच्छा मैसेज जाएगा अक़लियतों के सामने, और बिलखुसूस اردو دوست لوگوں جو اردو کو چاہتے ہیں, جن کی زبان اردو ہے, جن کو اردو سے محبت ہے, ان تک ایک اچھا پیغام جائے گا کہ یہ حکومت سنجیدہ ہے اردو کے تعلق سے, یہ حکومت سنجیدہ ہے اردو مدارس کے تعلق سے, یہ حکومت سنجیدہ ہے اردو پڑھنے والے اسٹوڈنٹس کے تعلق سے, یہ حکومت سنجیدہ ہے اردو کے ٹیچرز کے تعلق سے مسائل سے. تو اگر ایک میٹنگ بلائی جائے گی تو ایک اچھا پیغام ہم ان تک پہنچا سکتے ہیں. اور آنریبل پینل اسپیکر سر, یہ اس میں فائل جو ہم بولے تھے کہ اس میں پہلے بولے تھے ریگولرائزیشن آف کانٹریکٹ فیکلٹی ان گورنمنٹ ڈگری کالج آف تلنگانہ who are working for the past 22 years including in universities. یہ پہلے ہم اٹھائے تھے. پھر ڈی ایس سی 1998 اور 2000 میں qualified teachers post candidates تھے, post to be provided, یہی ڈی ایس سی کا پہلے بھی ہم میٹنگ میں لیے تھے. request for absorption of diet and اور اس کے بعد میں دوسرے ٹیچنگ کا نان ٹیچنگ سٹاف گورنمنٹ سکولز میں جو اردو میڈیم میں جو ہیں ان کے سروسز کو بھی لینے کے لیے ہم نے مطالبہ کیا تھا, لیکن وہ مطالبہ ویسی رکھا ہے. میں امید کرتا ہوں کہ اس پر بھی حکومت سنجیدہ غور کرے گی. Honorable Speaker, sir, going further ahead, sir, the government has enhanced the diet charges in post-matric hostelers to rupees 1,875 per month for pre-matric hostelers and 1,200 per month for class 5th and 7th and rupees 1,400 per month for class 8 to 10th. One key reason for achievement in the residential institution has been the recruitment of the required staff, including teachers and non-teaching staff, sir. So, Honorable Speaker, sir, I would like to say that کہ میں بار بار ایک بات بول رہا تھا, ابھی بھی بولوں گا, کہ آپ یہ کانٹریکٹ لیکچررز کو لیتے ہیں یا ٹیمپرری امپلائیز کو لیتے ہیں یا پھر کسی ایجنسی کو دے کے لیتے ہیں اور پھر ان کو ان کے سروسز کو بعد میں ریگولرائز کرتے ہیں. Whenever we taking the services and recruitment یا temporary basis پہ لے رہے ہیں, contract پہ لے رہے ہیں, sir, I have been requesting not once but many a times that کہ reservation policy کو follow کیا جانا چاہیے, لیکن یہ ہو نہیں رہا ہے. جتنے بھی contract lecturers ہیں اس میں مسلمانوں کو جو تحفظات جو 4% reservation کی بنیاد پر لینا چاہیے وہ نہیں ہو رہا ہے. وہ کچھ دن تک کام کرتے ہیں, بعد میں سروسز کو ریگولرائز کرنے کا مطالبہ کرتے ہیں اور حکومت ان کے سروسز کو ریگولرائز کرتی ہے. تو کانٹریکٹ کے جتنے بھی امپلائیز ہیں, چاہے وہ ٹیچرز ہو یا کوئی بھی ہو, تو جب ان کو ریگولرائز کرا جاتا ہے تو وہ 4% جو مسلمانوں کا حق ہے وہ نہیں ملتا اس میں. اور اس طریقے سے کئی محکمے جات میں بشمول تعلیم کے محکمے میں وہ مسلمانوں کا جو حق ہے ریزرویشن کا, وہ ریزرویشن سے مسلمان محروم ہو رہا ہے. میں بار بار یہ بات کہہ رہا ہوں, میں امید کرتا ہوں کہ حکومت اس پر بھی غور کرے گی. Sir, while the success of residential school is noteworthy, it remains the fact that the number of government-run schools, enrollment of school students and strength of the teachers have come down. Scores of government schools have been closed down and the number of private schools have gone up substantially. This should be a matter of concern. I hope that the enrollment of students and retention rate of students in the government schools will go up once the Mana Uru, Mana Badi and Mana Badi scheme is implemented in 3 phases with an outlay of 7,290 crores. I welcome this initiative. I welcome this plan. I welcome this program. I welcome that it has been decided in 3 phases that these schools will be improved. But at the same time, Honorable Speaker, sir, through you I would like to know, in first phase, how much of amount has been spent on Mana Uru, Mana Badi. This has not been mentioned in the note which has been given. Very clearly it has said in first phase we will be spending this much, in second phase this much, third phase this much. I want to know, what have you spent? How much of amount have you spent? Honorable Speaker, sir, I have the details, and if I have to go with the details, Speaker Sahab, you yourself would be surprised. So under RTI, I seeked an information, and this is the latest information, about the drinking water available. 26,602 schools have the drinking water facility, but 1,463 schools still yet do not have drinking water. And then compound walls, 17,322 schools have the compound wall, and 8,743 schools, that is to 34% schools, do not have a compound wall. So this needs to be taken care. Electricity, 24,589 schools have electricity, but 1,476 schools, that is 6% of government schools, still do not have electricity. Playgrounds, 15,698 schools have playgrounds. 10,367, that is 40% of schools, do not have playgrounds. Computer rooms available in 2,877, and where the computer is not available and it is required, I would say, is 1,765. Now coming to toilets, we have taken up good work, we have done a wonderful work, but still I would say 64,665 toilets are there, and 8,870 new toilets are required, that is 12%. Additional classrooms available, 1,10,723. The requirement is 9,997. That is very small percentage of only 8%. And I hope that the government will make a note and see that we fulfill these gaps and take care. Science lab available is 996. The requirement of science lab is 3,646. This is a concern. The requirement of science lab is 79%. Honorable Speaker, sir, it is 79%. So I hope that the government will make a note of the figures which I have just mentioned, sir. And going further ahead, in the twin cities of Hyderabad and Secunderabad, as well as in the other districts, the government school housed in their own premises lack basic infrastructure, including toilets and all, and I have given the details. The Education Minister, Sabita Indrareddy Sahiba, has talked about the new initiative to provide libraries and reading corners in 10,000 government schools. We also welcome the introduction of English medium parallel section in all government schools in phase for academic year 22-23 and 23-24. Sir, Honorable Speaker, sir, just 2 days back, I had a chance to visit a junior college in my constituency in Falaknuma Educational Campus. I was so saddened to see that there were a lot of girls in the classroom. They were sitting and studying, and it was very dark. They couldn't read. One classroom had only one tube light and only one fan. Immediately, I issued instructions to my people and my team, and I got in the entire junior college, we got some 14 tube lights fixed and some 12 fans we got, and we also told a contractor who was working there for the construction of a new junior college building, I told the contractor to take up the work for the toilets over there, because girl students are studying there. So it is really very sad state of affairs. Chanchalgoda Junior College also, the situation is just the same. And when we talk about Khile Golconda Junior College, Honorable Speaker, sir, you would be surprised and shocked to know this. There in Golconda Junior College, they didn't have lab, they didn't have proper classrooms, they didn't have a proper library. From my trust, which I have named it after my father, Salare Millet Education Trust, I gave 25 lakhs rupees. 25 lakhs rupees, sir. And we got, Kausar Saab is here, concerned MLA is here, we got the science lab, we got the library, we got the classrooms. And in Falaknuma, degree college, sir, in my constituency, the degree college was sanctioned, admissions were taken, but the staff was not provided. For 2 years, sir, students were studying without the required faculty. And then again from my trust, I gave, and 26 lakhs rupees we paid. Now there are some few vacancies. The vacancies have been filled. As of now, it is not like that now. It's improving. This was the situation 2 years back.
But now it is improving. So I would like to say that we need to see that the facilities are improved. It's the same situation. It's the same situation at Hussaini Alam Junior College. I request Honorable Education Minister Sahiba to kindly accompany us for a day, for just a few hours, so that we could just go and visit these campuses. Hussaini Alam campus, Golconda campus, and then we can also visit the Falaknuma campus. When Mr. Kadiyam Srihari, the then Deputy Chief Minister, was there, he was also holding the responsibility of Education Minister. I had taken him there, sir. That Falaknuma campus has an enrollment of more than 7,000 students over there. But still, the facilities are not there. I hope that these points which I am raising have been noted down, sir. Sir, introduction or bilingual textbook provisions of tabs to primary and upper primary school teachers and provision of free textbook and workbooks and notebooks are also welcome initiative which may help augment the enrollment in government schools and enhance the retention rate. I welcome this, sir. However, in every budget session and during the discussion of the budgetary demands of education, I have been highlighting the plight of Urdu medium schools, and once again, I am bringing to your kind notice, Urdu medium schools के ऊपर तवज्जो दीजिए. हम चाहते हैं कि उर्दू मीडियम के स्कूल्स खत्म ना हो. उर्दू मीडियम के स्कूल्स में बच्चे पढ़कर आगे बढ़कर निकलें. So there are several issues pertaining to higher education which needs to be tackled in an effective and immediate manner. There is a large number of vacancies of junior lecturers in government junior colleges, lecturers in government degree colleges, and university lecturers and professors in the state universities, sir. Sir, Honorable Speaker, sir, I would like to bring to your kind notice, sir, is that the total number of polytechnic colleges in the state of Telangana are 56. The sanctioned posts are 1,675. Working staff is 868. And the vacant posts are 807. That is 48% posts are vacant, sir. This is about the teaching staff, sir. Non-teaching staff, sanctioned posts are 1,972, working are 707, the vacant are 1,265, 64% vacant posts are there in non-teaching, sir. Sir, when we go to junior colleges, number of institutions are 407, the sanctioned posts are 6,656, the working staff are 985, and the vacant post, sir, the vacant post is 5,671, that is 85%. 85%. And when we go to degree colleges, number of institutions are 132, sanctioned posts are 4,376, working are 1,320, vacant are 3,056. 3,056, that means 70% of posts are vacant in degree colleges. And going further ahead in universities, number of universities are 11, sanctioned posts are 2,798, working are 906, and vacant are 1,892, that is 68%, sir. Sir, if we have to see, sir, the vacancy position in polytechnic, in junior college, degree college, and universities, the vacancy position is 74%, the vacant posts are 11,426. And if we have to see the non-teaching, sir, the total sanctioned are 10,596, the working is 5,124, and vacant are 5,472%, sir. Sir, the reason why I am bringing this to the kind notice of the government is that we need to take care in the field of education. We are doing wonderful work. We are doing wonderful work in residential schools, I would say, sir. The students are cracking and getting selected in IIMs and IITs. They are cracking the NEET exam. They are cracking the MSET exam. They are cracking the LAWCET exam. They are doing wonderful work, sir. But as far as the government schools are concerned, these are being neglected. The enrollment is falling, sir. Sir, I have the details, sir. I have the details, Honorable Speaker, sir. The dropouts in Telangana state as per UDISC, that is 2020 and 2021 data. One would say that Akbaruddin Owaisi is giving 2021 data. They give a data after 1 year. So the fresh data will come after some time. Enrollment primary level, 1st to 5th, 110.6%. Enrollment is very good, sir, 110%, sir, from 1st to 5th. Enrollment in upper primary 11, 6 to 8, 103.7. But the dropout level is 6.9%. Enrollment in secondary 11, 9 to 10 is 92.3%. The dropout level is 11.4, sir. Now, sir, now, when I have given you the details of the vacancy in higher education, so now you see, sir, enrollment in higher secondary, that is 11th and 12th, is 61.8%. And the dropout is 30.5%. 30.5%, it's a very high dropout. We need to take care of this and see that we bring down this dropout level. This is why I'm saying that we need to really concentrate and see that. And when we talk about, sir, there are 85 mandal in charge MEOs looking after one mandal each, sir. One MEO is in charge of 7 mandals. 8 MEOs are in charge of 5 mandals. Each 24 MEOs are handling 4 mandal each. 59 MEOs are overseeing 3 mandals each, and 87 MEOs are managing 2 mandals each, sir. Sir, the state has 30 districts, but the government has sanctioned the DO post for only 12 districts. DO for only 12 districts. Isn't it sad then? Sir, out of 12 DO sanctioned posts, only 7 DOs are working, and there are 5 vacancies at 26 districts. Only in charge DOs are running the show, sir. Sir, these figures are very upsetting, sir. Sir, in Telangana state, 56 deputy DOs posts are sanctioned. 56, sir. But only 6 deputy DOs are working and remaining 50 posts are vacant. This is what is the state. So this is a very, very sad state which needs to be taken care, sir, which needs to be given an importance, sir. Sir, again, also 70 senior lecturer posts are vacant in DIETs also. Similarly, out of 166 Telugu lecturer posts, 152 are vacant and only 14 are working, and out of 40 Urdu lecturer posts, 37 are vacant and only 3 are working in DIETs. If I am wrong, I may be corrected. If I am wrong, I may be corrected. It is subject to correction, sir. It is not that I am going to stand here and fight here, have my ego in between, my prestige in between, and say that, no, what I am saying is right. No, no. If my figures are wrong, kindly correct me. If I am wrong somewhere, kindly correct me. I am here to accept. But this is what is there which we need to improve. And at the same time, I would say that the government has proposed a common recruitment board to recruit teaching faculty in universities. This August House has passed the Telangana University's Common Recruitment Board on 12th of September 2022, but the bill has but the bill is pending clearance with the Honorable Governor. I don't know the fate of that bill, sir. We want to know the fate of that bill also. In the meantime, the government has notified 3,232 vacancies of teaching and non-teaching staff for recruitment through the Telangana State Public Service Board. I would like to know from the government the time frame for filling up these vacancies. It is very important. When are you going to fill up these vacancies? The government has taken a welcome decision to regularize the services of 3,896 contract employees in education department, including 3,096 in intermediate education, 520 in technical education, and 280 in college department. Telangana government has introduced a free education for intermediate course. Sir, free education for intermediate course in the government junior colleges, and our state is the first such state in the country to do so, sir. We are here to appreciate what is good. My criticism is always a constructive criticism, sir. I congratulate the government, Telangana government, for introducing a free education for intermediate courses in the government junior colleges, and our state is the first such state in the country to do so. However, there is a need to improve the infrastructure in the government junior colleges in a phased manner. Phased manner. मैं जानता हूं एक साथ तो नहीं हो सकता. Phased manner, so that the facilities are on par with corporate junior colleges. The higher education, colleges and technical education is accorded higher budgetary allocation, but most of the state universities, including the older state, Usmania University, are facing resource crunch. Usmania University, for instance, has adopted this budget for 23-24 with an estimated expenditure of rupees 753.79 crores as against the block grant of rupees 685 crores from the government. The shortfall comes as 42.65 crores after adding up an opening balance of 24.36 crores. Faced with the shortfall, the Usmania University has raised steeply the tuition fee for courses in campus and constituent colleges, drawing the ire of the university students. Sir, I request, sir, through you I request, sir, जो उस्मानिया यूनिवर्सिटी के जो पैसे कम हो रहे हैं, कितने हैं सर? ज्यादा नहीं है सर, इट्स ओनली 42 करोड़. एक 50 करोड़ आप रिलीज कर दीजिए उस्मानिया यूनिवर्सिटी को खुद ब खुद जो कोर्सेज के जो फीस बढ़ाए हैं यूनिवर्सिटी, वो कम हो जाएंगे और स्टूडेंट्स जो एहतजाज कर रहे हैं कि फीस बढ़ा दी गई है, वो भी खत्म हो जाएगा. ज्यादा पैसा नहीं है यार, आप 50 नहीं तो सिर्फ 20 दे दीजिए. Sir, there are so many other issues that need proper attention of the government, and I hope that the government will tackle these issues to the satisfaction of all the stakeholders, and I'm confident and I know that all the issues which has been brought to notice by me will be attended by this government, and this government is doing step by step improvement in all fields, and I am sure that Telangana हुकूमत ये तालीम के मैदान में गवर्नमेंट स्कूल्स के बारे में जो मैंने कहा है, जूनियर कॉलेजेस, डिग्री कॉलेजेस, यूनिवर्सिटीज के ताल्लुक से, इस पर भी हुकूमत संजीदगी के साथ गौर करेगी, इस पर भी जरूरी इक़दामात करेगी, और हम कोशिश करेंगे कि बंगारू तेलंगाना सिर्फ बंगारू तेलंगाना एक शोबे में या दो शोबे में न रहे, बल्कि तालीम के शोबे में भी तेलंगाना बंगारू होगा, टीआरएस हुकूमत और चंद्रशेखर राव साहब की क़यादत में. और जितने भी मसाइल मैंने उठाए हैं, उम्मीद करता हूं कि हुकूमत इसका नोट लेगी. बिलखुसूस उर्दू के ताल्लुक से मैंने जो कहा है, उर्दू असातिज़ा के ताल्लुक से, उर्दू तुलबा के ताल्लुक से, उर्दू स्कूल्स के ताल्लुक से, इस पर जरूर करेंगे. और फिर से स्पीकर साहब, मैं आपके जरिए मैडम सविता इंदिरा रेड्डी साहिबा का शुक्रिया अदा करता हूं और उनसे दरखास्त करता हूं कि एक मीटिंग बुलाइए, हम बैठते हैं, उर्दू के मसाइल आपके सामने रखते हैं. ऑनरेबल स्पीकर सर, ऑन द रिक्वेस्ट ऑफ ऑनरेबल Finance Minister and Health Minister, I have to continue with the other subjects, sir. Now coming to the discussion on the measures taken by the government for strengthening the health sector in the state, I would like to touch upon few issues, sir. Compared to the situation that prevailed at the time of formation of Telangana state in June 2014, there has been a tremendous transformation in the medical and health sector in the state, sir. Thanks to the various initiatives taken by the government and the higher budgetary allocation made for medical and health sector in the state budget for the last 10 years, Telangana has crossed several milestones, overtaking many other states in the country when we talk about the field of health, sir. I compliment the Telangana government for achieving full immunization of children, 100%, sir, in the year 2022. I congratulate the Health Minister also for this, sir. In the year 22, sir, the infant mortality rate has decreased to only 211 now, sir. This is also a very big achievement by the Telangana government, sir. The state has filled up to 22,455 vacancies of doctors, nurses and paramedical staff in the last 9 years, and recruitment of another 6,880 nurses and other paramedical staff is in progress, sir. I congratulate the government for this achievement, sir. So the government has decided to set up medical colleges in each of the 33 districts in the state. From only 5 government colleges in 2014, the state now has 26 government medical colleges, and 8 government medical colleges have been sanctioned recently also. I congratulate the Finance Minister, I congratulate the government of Telangana, I congratulate the Honorable Chief Minister Saab, KCR Saab, under whose leadership the health sector is growing and achieving a milestone, sir. The Honorable Speaker, sir, the state has highest number of MBBS seats per lakh of population and second highest postgraduate seats per lakh population. The number of MBBS seats in government medical college has increased fourfolds to 3,550 now. The number of PG seats in government medical colleges more than double to 1,316 now, sir. Sir, Honorable Speaker, sir, when I congratulate the Honorable Finance Minister and the Health Department and also the Honorable Chief Ministership under whose able leadership this achievement is happening. At the same time, sir, through you, I would like to ask the Honorable Finance Minister Saab, when he rise to give a reply, kindly give us a reply as to what is the amount that is spent to make one MBBS doctor. What is the money that is incurred to make one doctor? Also give me the detail as to what is the amount that is incurred to make one postgraduate. And also the amount incurred to make one super specialist. Sir, the reason why I am saying this is, sir, that people need to know that what is it that the government is spending to make one doctor. What is it the government is spending to make one postgraduate? What is it the government is spending to make one super specialist? Sir, and at the same time, sir, through you, I would like the Honorable Finance Minister to give the details as to how much of faculty, how much of teaching and non-teaching staff is required for establishing one medical college with a hospital, sir. Also kindly give a detail as to what is the amount that would be incurred per month and per year, sir, on establishment and running of one medical college with a hospital, sir. People need to know that. People think that it's very easy to establish a medical college and a hospital. It's not that easy to establish a medical college. Because we run a medical college, we run a hospital, we know how tough it is. It is very tough, sir. Sir, at the same time, sir, I would like to bring to your kind notice, sir. Sir, as far as postgraduate studies are concerned, sir, in the other states, in the convener quota, the fees is reimbursed for postgraduate by the state government. And after completion, they are absorbed as senior residents in the government colleges. But sir, in the other states, sir, the convener quota, fees is borne by the student, the stipend is paid by the state government. Sir, I request to kindly look into it. If it is possible, we should also implement that. We should also see that. Because sir, the reason why I am saying is that, sir, when we say that, the number of seats, sir, the number of postgraduate seats in government medical college are more than double to 1,316 now. Sir, for every postgraduate, a stipend has to be paid. For every postgraduate student, you have to pay him that monthly money. Or shayad, if I am not wrong, it is somewhere around 50 plus or something, 53 or 56. Now they have enhanced it. So, agar aap dekhenge, sir, ye amount 1,316, then this amount goes up. It's a burden. And as per my calculation, sir, the state government would require for UG and PG interns and postgraduates plus senior residents ke jo mahana aap paise denge yearly, it is going to cross more than 1,000 crores. So we need to see that. We have to have a good planning for that also, sir. And sir, going further ahead, sir, beside taking up the work of augmentation of Nizam Institute of Medical Sciences from 1,500 to 3,500, the Honorable CM Saab has also decided to establish 5 super specialty hospitals apart from 2,000 bedded hospital in Warangal city. 4 super specialty hospitals are being established in Hyderabad with 1,000 to 1,200 beds each. The government hopes to raise the total number of hospital beds in all government hospitals in the state to 50,000, sir. I congratulate you on this also, sir. It is a very big, ambitious program that the government is taking up, sir. It is not easy, sir. I congratulate. He's doing a wonderful work again in this field, sir. Sir, at the same time, sir, when I say that कि Honorable Chief Minister साहब निजाम इंस्टीट्यूट ऑफ मेडिकल साइंसेस को आगे बढ़ाने का मंसूबा रखते हैं, तो स्पीकर साहब आप भी जानते हैं साहब, हमारे पुराने शहर का एक ही दवाखाना है, उस्मानिया दवाखाना. हम बार बार बोलते रहे उस्मानिया दवाखाने के ताल्लुक से. आज मैं यहां खड़े होकर फिर यह बात दोहरा रहा हूं कि उस्मानिया दवाखाने को आप तामीर करिए, उस्मानिया दवाखाने को नया दवाखाना बनाइए। जब मैं उस्मानिया दवाखाने की बात करता हूं तो उसके साथ साथ मैं ये भी जरूर कहना चाहता हूं कि आप खास तवज्जो रखें कि उस्मानिया दवाखाने में मौजूद मंदिर, मौजूद मस्जिद और मौजूद खबरस्तान को कोई भी हाथ नहीं लगाएगा। यह जरूरी है, क्योंकि बाज लोगों की नातजुर्बेकारी की वजह से जो काम हुए हैं उससे हुकूमत की नेकनामी मुतासिर हुई। मैं उम्मीद करता हूं कि उस्मानिया हॉस्पिटल के ताल्लुक से आप गौर करेंगे। इसके साथ ही साथ ऑनरेबल स्पीकर सर, मैं और एक बात आपसे कहना चाहता हूं कि बार बार मैं मिनिस्टर साहब को बताया भी हूं, लेकर भी जाके दिखाया। आज आप किसी को भिजा के देखिए मिनिस्टर साहब कि चारमीनार यूनानी दवाखाने का क्या हाल है। अगर उस पर तवज्जो नहीं दी गई तो उस्मानिया दवाखाने की तरह वो भी गिर जाएगी। होता यही है कि तवज्जो का अदम शिकार होती है हमारी इमारतें, और उसके बाद में कोई तवज्जो नहीं दी जाती, मखदूज हो जाती हैं, डिलैपिलेटेड कंडीशन में हो जाती है। उसके बाद कहा जाता है कि इसके अंदर जाएंगे तो लोग मर जाएंगे, लिहाजा इस इमारत को गिरा दो, और हमारे असलाफ की यादगार निशानियों को इस तरीके से मिटा दिया जाता है। मैं उम्मीद करता हूं कि निजामिया तिबी कॉलेज पर आप तवज्जो देंगे मिनिस्टर साहब, कुछ पैसा दीजिए साहब। मैं 10 साल से पुकार रहा हूं, चीख रहा हूं, चिल्ला रहा हूं, निजामिया निजामिया, चारमीनार दवाखाना निजामिया, लेकिन आज भी उस पर तवज्जो नहीं है। वो भी गिर जाएगा। उस्मानिया तो गिरने पे है, गिर रहा है, अब ये भी गिर जाएगा। तो खुदारा निजामिया तिबी कॉलेज पर तवज्जो दीजिए साहब कि निजामिया का बहुत बुरा हाल है। मैं उम्मीद करता हूं कि आप इस पर तवज्जो देंगे। और मैंने थोड़े दिन पहले भी आपसे कहा कि बारकस एरिया हॉस्पिटल है चंद्रायन गुट्टे में, और खिले गोलकुंडा का हमारा दवाखाना है गोलकुंडा में, और नामपल्ली हॉस्पिटल है, उस ताल्लुक से भी कहा। और फिर से मैं कह रहा हूं, अफसोस होता है मुझे कहते हुए ऑनरेबल स्पीकर सर, बहादुरपुरा असेंबली कॉन्स्टिट्यूंसी में एक छोटा सा हेल्थ सेंटर है पालम रोड पे, और उस हॉस्पिटल कमाटीपुरा में पालम रोड में, मिनिस्टर साहब बहादुरपुरा असेंबली कॉन्स्टिट्यूंसी में सिर्फ एक ही है छोटा सा हेल्थ सेंटर पालम रोड में। उसकी बड़ी जमीन है, वो हॉस्पिटल के लिए कुछ पैसा दीजिए ताकि उसको डेवलप कर सके। पुराने शहर में एक छोटा सा एक 100 बिस्तर का दवाखाना पालम रोड पे आ सकता है, एक 100-150 बिस्तर का दवाखाना गोलकुंडा में आ सकता है, एक 100-200 बिस्तर का दवाखाना हम बारकस में भी कर सकते हैं। और इन सारे हॉस्पिटल्स में हम बार बार बोलते रहे डायलिसिस सेंटर के लिए, डायलिसिस सेंटर का हम मुतालबा कर रहे हैं। उम्मीद करते हैं कि मिनिस्टर साहब वो डायलिसिस सेंटर के ताल्लुक से भी जरूर हमदर्दी के साथ गौर करेंगे, और पुराने शहर के लोगों के सेहत के ताल्लुक से भी आप वही दिलचस्पी लेंगे जो रियासत के दूसरे इलाकों के लोगों के ताल्लुक से आप लेते हैं। सर, अनदर वेलकम इनिशिएटिव इज द डिसीजन टू एस्टैब्लिश a 100-bedded hospital in every assembly constituency in the state. Such hospitals are sanctioned in 107 assembly constituencies, sir. I thank the Honorable Chief Minister Saab, I thank the Honorable Finance Minister and Health Minister Saab and the Government of Telangana for this achievement, sir. Sir, another good initiative has been the establishment of Basti Dawakhana in the municipal areas of the state, particularly in GHMC area. There is a need to strengthen these Basti Dawakhanas with more staff, stocking of adequate quality of medicine, equipping them with diagnostic facilities, etc. Also, there is a need to establish more dialysis centers all across the state to provide free dialysis to the poor patients, sir. Honorable Speaker, sir, when I talk about poor patients, sir, I would like to request through you, sir, from last 5 years I've been requesting, sir. Sir, this is about Arogyashri rates. Arogyashri rates, sir, needs to be enhanced, needs to be corrected, sir. It has been more than 10 years that the Arogyashri rates have not been enhanced. But at the same time, sir, I thank the Telangana government for increasing the amount from 2 lakhs to 5 lakhs, sir. This is a very good initiative. I thank the government. Sir, when I say that to increase the Arogyashri tariff, I request the Honorable Minister Saab kindly review all the hospitals who were permitted for Arogyashri cases and they are not doing or taking Aragasiri cases, their registration should be cancelled. The moment you are going to enhance the rate, all these hospitals will jump in that. When the rates are less, they don't want to take the cases. When the rates are enhanced, they will jump. So before enhancing, sir, you should call for the list of all, the empaneled list of all the Aragasiri hospitals, treating hospitals, and see that which hospital has not taken or admitted an Aragasiri patient from a long time. साहब उनका आप registration cancel करिए और नए hospitals को लीजिए. And at the same time, sir, Malla Reddy साहब is here. He will agree with me. वो अग्री करेंगे मेरी बात को. सर टीचिंग हॉस्पिटल्स के लिए सर आरगश्री में बहुत से केसेस है जो सिर्फ गवर्नमेंट हॉस्पिटल्स में है. आरोग्यश्री में बहुत सारे केसेस, वो केसेस को टीचिंग हॉस्पिटल्स को दीजिए साहब. टीचिंग हॉस्पिटल्स को इफ यू आर गोइंग टू गिव, द टीचिंग हॉस्पिटल विल गेट अ टीचिंग मटेरियल सर. सर नाउ दैट यू आर कमिंग अप विथ सो मेनी हॉस्पिटल्स, so many medical colleges, I am sure, sir, the private medical colleges will have a tough time getting the OP, getting the IP. So for that, I request the Honorable Finance Minister Sahab, Health Minister Sahab, to kindly see that these cases which under Aragashiri, which can be done only in government hospitals, should be allowed to private hospitals, teaching hospitals only teaching hospitals who have medical colleges. Honorable Speaker, sir, KCR Kit Scheme and KCR Nutrition Scheme are good initiatives, sir, which have led to increase in institutional deliveries to 100%, sir. The KCR Nutrition Kit Scheme introduced in 2022 is expected to benefit 6 lakh pregnant women every year, sir. तो मैं ये इसलिए बता रहा हूं कि ये भी गैर मामूली कामयाबी है हुकूमत की. KCR kit की इसके लिए मुबारकबाद देता हूं. I would like to point that the record allocation of rupees 11,595 crores for health and medical services in the state budget for 2023 to 2024 works out to 3.99% of the total budget. In the previous financial year 22-23, rupees 10,711 crores was allocated, which works out to 4.17% of the total budget, sir. Allocation for upgradation of facilities and provision of infrastructure and equipment at teaching hospital and state capital are also not adequate, sir. Sir, Usmania Gandhi, Nilofer, chest, MNJ, cancer, fever, ENT, Sarojini Devi Eye Hospital, mental hospital, maternity hospital at Petla Burud, Sultan Bazar and Shali Banda and area hospital at Barkas, Malakpet, Golconda, Nampally, Kinkoti requires more funds for expanding the facility and additional of beds, since there is rising demand for deliveries and surgeries at the government hospital to avail benefits under KCR kit scheme, sir. Sir, Honorable Speaker, sir, the Gandhi Hospital and Usmania Hospital are running out of beds since they are flooded with hordes of patients suffering serious disease and requiring urgent treatment, sir. So there is overcrowding in emergency, gynecology, medicine and surgical wards of these two general teaching hospitals. Although the Gandhi has a strength of 1,900 beds, even then it is not able to meet the current requirement. It is premier tertiary care institution, but the patients have to sleep on the floor, sir. Sir, also I have spoken about the Usmania Hospital के बारे में मैं आपसे बोला हूं. मैं उम्मीद करता हूं कि आप जरूर इस पर गौर करेंगे. और चीफ मिनिस्टर रिलीफ फंड में भी सर हम कई लेटर्स देते हैं. उसमें जितना भी अमाउंट हम देते हैं, तो अगर 1 लाख का बिल दिए तो उसको 50,000 आता है. तो मैं आपके जरिए हेल्थ मिनिस्टर साहब के तवज्जो लाना चाहता हूं कि सीएम रिलीफ फंड में हम जो देते हैं सीरियस एलिमेंट के लिए, जो जितना पैसा जो ट्रीटमेंट का आ रहा है, उसका कम से कम 80% तो भी आप दे दें तो बड़ी मेहरबानी होगी. उससे गरीब का एक फायदा होगा. तो मैं उम्मीद करता हूं कि आप इस पर भी जरूर तवज्जो देंगे और जो जो मसाइल मैंने उठाए हैं इस पर आप जरूर हमदर्दाना गौर करेंगे. और मैं आपसे फिर से यह बात जरूर कहूंगा कि रियासत तेलंगाना हेल्थ के सेक्टर में बहुत तेजी से आगे बढ़ रहा है और वो दिन दूर नहीं है कि हमारे मुल्क हिंदुस्तान में, भारत में नंबर 1 स्टेट होगा हेल्थ के फील्ड में, तो वो तेलंगाना होगा. मैं मुबारकबाद देता हूं और आपने जो मौका दिया मुझे, इसका मैं शुक्रिया